National Grief Awareness Day. National Grief Awareness Day recognizes the time it takes to heal from loss that doesn't have a prescribed course and is a reminder closure comes in many forms. When a loved one dies, the void they leave affects everyone differently. The death of a loved one, a close friend, or enduring an extreme change in their lifestyle can trigger grief. When we lose the stability of shelter, a job, or a routine we have known for years, we suffer a type of loss that requires closure. Some adjust to these changes easily, and others take time to become familiar with their new routines. We produce 5 videos per week, so please click on the like button and subscribe to see future videos. Like, comment, share, subscribe. Offer to listen to a friend and ask them to join you for coffee or tea. Then set another visit. If you find you are suffering from grief, know that it's natural. You're not alone, and it's okay to ask for help if you feel your grief is overwhelming. What causes grief? While it's not clear exactly what causes prolonged or complicated grief, the cause of normal grief can most commonly be attributed to the death of a loved one. According to the University of Rochester, grief can also be caused by the following: loss of a job, loss of a beloved pet, loss of a friendship, loss of a personal dream, or loss of a romantic relationship. Emotional symptoms of grieving. A person who is dealing with grief will most likely display some of the emotional symptoms associated with grieving. These can include increased irritability, numbness, bitterness, detachment, preoccupation with loss, and the inability to show or experience joy. The 5 stages of grief. Stage 1, denial. Grief is an overwhelming emotion. It's not unusual to respond to the intense and often sudden feelings by pretending the loss or change isn't happening. Denying it gives you time to more gradually absorb the news and begin to process it. This is a common defense mechanism and helps numb you to the intensity of the situation. Stage 2, anger. Where denial may be considered a coping mechanism, anger is a masking effect. Anger is hiding many of the emotions and pain that you carry. This anger may be redirected to other people, such as the person who died, your ex, or your old boss. You may even aim your anger at inanimate objects. Stage 3, bargaining. During grief, you may feel vulnerable and helpless. In those moments of intense emotions, it's not uncommon to look for ways to regain control, or you want to feel like you can affect the outcome of an event. In the bargaining stage of grief, you may find yourself creating a lot of what if and if only statements. Stage 4, depression. Whereas anger and bargaining can feel very active, depression may feel like a quiet stage of grief. In the early stages of loss, you may be running from the emotions, trying to keep a step ahead of them. By this point, however, you may be able to embrace and work through them in a more healthful manner. You may also choose to isolate yourself from others in order to fully cope with the loss. Stage 5, acceptance. Acceptance is not necessarily a happy or uplifting stage of grief. It doesn't mean you've moved past the grief or loss. It does, however, mean that you've accepted it and have come to understand what it means in your life now. Physical symptoms of grieving. It may come as a surprise that grief is not entirely emotional. There are very real effects that grief can have on the body. Some of the physical symptoms of grieving are digestive problems, fatigue, headaches, chest pain, and sore muscles. Grief can have both the short-term and long-term effects for affected individuals. Short-term effects might include the inability to attend work or school, or a lack of desire to attend social gatherings. Long-term effects can be more serious in nature. Long-term effects of grief can be different depending on the type of loss you or your loved one has experienced. When untreated, grief can lead to physical and mental health problems in some people. Is there a test or self-assessment for grief? If you believe you are, or a loved one is, having an issue with prolonged or complicated grief, the Mayo Clinic recommends looking for some of the identifying factors of this type of grief, such as agitation, social withdrawal, emotional numbness, or a sense that life no longer has any meaning. Medications specifically indicated for prolonged or complicated grief may not be easy to identify on your own. Your healthcare provider might be able to help you find drug options that work for your specific needs. Medication will not take away your grief or sense of loss, but it can help lessen some of the symptoms. The takeaway. The key to understanding grief is realizing that no one experiences the same thing. Grief is very personal, and you may feel something different every time. You may need several weeks, or grief may be years long. If you decide you need help coping with the feelings and changes of grief, a mental health professional is a good resource for vetting your feelings and finding a sense of assurance in these very heavy and weighty emotions.